Before you load creatine, watch this. If you're about to start a creatine loading phase, this is your must-see, science-backed breakdown of the real side effects and how to avoid them. If you've searched creatine loading side effects, creatine bloating, creatine water retention, does creatine damage kidneys, creatinine EGFR, creatine hair loss DHT, or do you need to load creatine? You're in the right place. In the next 12 minutes, I'll explain why some people experience scary lab results after starting creatine, whether creatine actually threatens your kidneys, the truth about hair loss and DHT, how to prevent stomach issues during loading, and exactly when you should skip the loading phase and take 3 to 5 grams per day instead. You'll get a simple, safe protocol that preserves all the strength and performance benefits of creatine without the bloat, the bathroom rush, or the lab confusion. So you can train harder, feel better, and still sleep at night knowing you did it right. Do you actually need to load creatine? Let's start with the big decision. No, you don't need a creatine loading phase to get results. Loading, typically about 20 grams per day for 5 to 7 days, saturates your muscles faster, which can bring strength and power benefits forward into week 1. But a maintenance approach, 3 to 5 grams per day, no loading, gets you to the very same destination in about 3 to 4 weeks. The trade-off is simple. Loading equals speed with a higher chance of side effects. No loading equals patience with better comfort and fewer surprises on the scale. For most lifters, especially beginners or anyone with a sensitive stomach, the slow and steady plan is the smartest path. Kidney safety and the lab result that freaks everyone out. Here's the #1 fear. I started creatine, my creatinine went up, and my EGFR dropped. Are my kidneys in trouble? In healthy adults using recommended doses, decades of controlled research and expert position stands have not shown that creatine monohydrate damages kidney function. The confusion comes from the way we measure kidney filtration. Creatine naturally breaks down into creatinine, which is used in equations to estimate kidney function, EGFR. When you supplement creatine, your creatinine can rise even though your kidneys are working perfectly. That can make EGFR look artificially lower on paper. It's a measurement quirk, not necessarily an injury. If you take creatine and need an accurate assessment, tell your clinician you supplement, get your labs while well hydrated, and consider asking about cystatin C or a combined EGFR equation that is less influenced by creatinine shifts from supplementation. If you already have kidney disease, a single kidney, diabetes with kidney involvement, or you're on medications that can stress the kidneys, get medical guidance before touching a loading phase. Better yet, use the conservative 3 to 5 gram approach or skip creatine entirely until cleared. For healthy, hydrated users at standard doses, creatine remains one of the safest and most studied supplements in sports nutrition. Hair loss and DHT, what the evidence really says. Another headline that scares people is creatine causes hair loss. The claim largely traces back to a small study that observed a rise in dihydrotestosterone, DHT, after a loading and maintenance period in athletes. Crucially, that study did not measure hair loss, just hormone levels, and later research has not consistently replicated a meaningful or lasting DHT increase with typical creatine use. There are no high-quality trials proving that creatine monohydrate causes hair loss in healthy men. If you have a strong family history of androgenic alopecia and the thought worries you, skip the loading phase, use 3 to 5 grams per day, and monitor over a few months. If you're already on a hair loss plan such as finasteride or topical minoxidil, standard creatine dosing has not been shown to undermine it, but discuss any concerns with your clinician. The practical take, the creatine equals baldness, headline is not supported by robust evidence. Focus on training, nutrition, and consistency. Choose the non-loading route if peace of mind helps you adhere. The bloat, explained. Why the scale jumps 2 to 6 pounds. The most visible side effect in week 1 of a loading phase is rapid weight gain, typically 2 to 6 pounds. This isn't fat gain. It's largely intracellular water retention as muscle creatine and phosphocreatine stores rise. That extra water inside your muscles is part of the mechanism that improves high-intensity performance, helping you regenerate ATP faster between efforts. Many lifters actually look fuller rather than puffier after the first week or 2. The feeling of bloat is usually temporary and settles as your body equilibrates. If you compete in a weight class sport, loading right before a weigh-in is a bad idea. Finish far in advance or stick to 3 to 5 grams per day from the start. If a sudden scale jump stresses you out, pick the slow ramp. You will reach the same saturation without the shock. Stomach issues during loading. Why they happen and how to prevent them. Gastrointestinal discomfort is the most common real side effect of loading. High single doses pull water into the intestines and can lead to cramping, gas, nausea, or diarrhea, especially if you take creatine on an empty stomach or toss it into cold water and chug it half dissolved. If you choose to load, make it gentle. Split the 20 grams into 4 smaller servings of about 5 grams each. Pair them with meals or a protein-carb snack. Dissolve the powder fully in warm water or tea and let it sit a minute until it's clear, and sip instead of slamming it. Micronized creatine monohydrate mixes more easily and is often friendlier on the gut. If you're sensitive, try a half load such as 10 grams per day in 2 to 3 doses for a week, or skip loading altogether and start with 3 grams daily for 2 weeks, then move to 5 grams. The fastest way to a bad loading experience is a giant single scoop on an empty stomach. The easiest fix is patience, food, and smaller doses. Loading versus 5 grams daily, speed, comfort, and the timeline. Here's the timeline you can expect. A classic loading phase at roughly 20 grams per day for 5 to 7 days saturates your muscle stores quickly, and many people notice strength or power improvements within the first week or 2, provided their training is dialed in. A no-loading plan at 3 to 5 grams per day reaches the same saturation by weeks 3 to 4. After a month, the performance outcome is essentially the same either way. So choose based on your context. If you need the benefits urgently and tolerate supplements well, load smart. If you want fewer side effects and don't mind waiting a few weeks, skip loading and rely on consistency. Who should avoid or be cautious with loading? Loading is not for everyone. If you have chronic kidney disease, uncontrolled hypertension with fluid issues, diabetes with kidney involvement, a history of kidney stones or severe GI disorders, or you're taking medications that are hard on the kidneys, get medical clearance before using creatine. Pregnant or breastfeeding individuals should avoid it due to limited safety data. Weight class athletes close to competition should not load near a weigh-in. Teens can respond well to creatine, but best practice is parental consent, coach or clinician supervision, and a conservative, no-loading approach that emphasizes sleep, nutrition, and training first. Kidney labs, hydration, and how to talk to your doctor. If you plan to start creatine, getting baseline labs can be helpful, particularly if you have risk factors. If you're already taking creatine and a lab shows higher creatinine with a lower eGFR, do not panic. Inform your clinician about your supplementation, repeat the test while well hydrated, and ask whether a cystatin C-based estimate or a combined equation is appropriate. These alternatives are less affected by creatinine fluctuations and can provide a clearer picture of kidney function in people who supplement. If anything feels off, unusual swelling, persistent flank pain, or significant changes in urination, stop supplementation and seek medical advice. Exactly how to do it safely. If you decide to load, use creatine monohydrate and split roughly 20 grams per day into 4 5-gram servings for 5 to 7 days. Take each serving with a meal, dissolve it fully in warm liquid, and sip it. After the loading week, drop to a maintenance dose of 3 to 5 grams per day. If you prefer not to load, start at 3 grams per day for a week or 2, then move to 5 grams daily as your long-term maintenance. In both cases, keep your hydration steady, train hard, and be consistent. If you experience persistent diarrhea, severe cramping, or unusual swelling, stop and reassess. Most issues resolve by reducing dose, pairing with food, or switching to the maintenance-only plan. What's not a creatine side effect, but gets blamed on it? Creatine often catches blame for things it didn't cause. Poor sleep from late-day caffeine, high sodium intake from restaurant meals, or brutal soreness from a brand new training block can make you feel puffy, tired, or beat up. But creatine is not the culprit. Separate your variables, control your diet, manage caffeine timing, train progressively, and let creatine do its quiet job in the background. If this helped you decide whether to load creatine or stick with 3 to 5 grams a day, Hit like so more people searching creatine loading side effects, creatine bloating, and is creatine safe can find it. Drop a comment with your experience. Did you load? And how did your body respond? Subscribe for more evidence-based breakdowns on supplements, strength, and performance so you can train with confidence and get results you can measure.